I don't have to move. I cannot. I cannot stay in place. I know, but you have to. What? Oh, you be terrible. I'm not. I'm telling you. Jose, I need to see. Yeah. Okay. So do I remove my? Is it, is it okay if I keep the hat on? Yeah, but we are at UNAM now. Okay. As you feel comfortable. It gives you a lot of personality. And the boys are going to love it. Okay. So party tonight? I need to close my phone. The microphone higher. Is it better like that? Can you hear me well? Yeah. Okay. Can I have? No, I cannot move that. This is the microphone better than this. Oh, I have the good. I will take this year.
Hola, buenas tardes. Hoy tenemos una conferencia por el doctor Mohamedou Diaw. Él estudió veterinaria en Senegal y estuvo haciendo su práctica profesional en Francia. En 2016 estuvo haciendo medicina del deporte en equinos en Kentucky y ahí decidió cambiarse a reproducción en 2007, perdón. Y después se fue a hacer una residencia en Florida de 2008 a 2011. En el 2013 estuvo trabajando como profesor en la Universidad de Carolina del Norte y a partir del 2011 está certificado por el Colegio Veterinario Americano de Teriogeniología y tiene una maestría en la Universidad de Montreal. Desde el 2014 es un profesor asociado en la Universidad de Montreal en Canadá, donde es experto en reproducción equina y canina. Hoy nos va a presentar el tema de qué es lo nuevo en endometritis equina. Muchas gracias, doctor Dio.
Gracias, Dr. Hilda. So, good morning. I am happy to be here with you today. So, unfortunately, my Spanish is not very good. I'm still looking to improve it. So, my presentation will be in English. If I speak too fast, please don't hesitate. Stop me. If you have questions, also, Dr. Hilda and Dr. Daniela might be around and they can translate for you. Is it okay like that? And can I keep my hat? Because the student in Zacatecas, they offer me that hat and I really love it. That's why I have it. So if it's okay with you, I'm gonna keep it. So today I will like to talk about persistent endometritis. So endometritis by itself in equine reproduction, it's a big, big, big problem. But I will focus today only on equine, on post-breeding endometritis, because we have a little bit less than 2 hours. And to cover the subject, it will be, if I wanted to cover all the endometritis subject, I will need half of the day or maybe the entire day. So I have nothing to declare. So first, I wanted to discuss the physiopathology of persistent post-breeding endometritis. So this is an idea of how things are going, but I will not go in everything it is in this chart because it's going to take us too long. I will go only to the main subject I wanted to discuss today. So first, a mare has been bred, so naturally or artificially. So there is semen that is in the uterus, and semen is something that is not natural in the uterus. It will cause an inflammation. It is completely physiological. The thing is, normally what's happening is a mare is within 48 hours is supposed to clear herself of the inflammation caused by the presence of spermatozoa in her uterus. So we said that this mare is resistant. On the other hand, when it does not work very well, we are talking about a mare that is sensitive. So the mare is not able to clear her uterus by herself. So what's happening at that time? We have an influx of white blood cells, we have debris, we have bacteria, and at that time the problem will start. So it will cause a huge inflammation, and as I was telling you, you can have infection, bacteria, or you can have fungus that will develop at that time also. And with fungus, it will be more complicated and more difficult to treat usually. And we're going to end it with a chronic inflammation, with a fibrosis, and that will affect the fact that the mare will lose a part of her ability to be pregnant or to get pregnant and keep pregnancy to term. So today I will just focus, as I was telling you, on persistent equine endometritis. So what are the treatments that we use mainly to prevent this problem to occur? So I will say first that persistent breeding endometritis is more often when we are using frozen semen. Why? Because when we are using frozen semen, we centrifuge the ejaculate, we use a high concentration of sperm, and sperm gonna cause a huge inflammation in the uterus. But you can also have a persistent post-breeding endometritis with fresh or cool semen, or when you have natural breeding, but most of the time, this problem is seen when we are doing the frozen semen. So how do we treat those mare at that time? So the first product I will use are embolic agent. There are two that you can use, oxytocin and prostaglandin, artificial prostaglandin. So oxytocin, it is a drug I use most of the time. So it acts very fast. I use it IM or IV. Its action start, I will say, 2 to 3 minutes after injection. It will cause contraction of the myometrium, and it will cause expulsion of the debris, of the dead sperm, of whatever is in the uterus, and that we don't want to have it there. So there is also what we called, sometimes instead of using oxytocin by itself, what we call the stallion effect is after breeding a mare, you leave her outside, and nearby that mare, not with the mare, but nearby, you can have a stallion around. So the mare seeing the stallion and the mare being in heat, because we breed the mare when she's in heat, there is a natural discharge of oxytocin from the mare that will act exactly the same. So there were a study that was made in Kentucky showing that having a stallion close to a mare post-breeding will reduce the risk of post-breeding endometritis. So the thing is, with oxytocin, the effect is very short, half an hour maximum. So to make sure that you clear the uterus and you clear it efficiently, what you do at that time, we have to redo injection every 2 to 8 hours to make sure that the uterus will stay clean. And I used to give this treatment, I will say 2 to 3 days, no more than 2 days post-ovulation, because after 2 days post-ovulation, progesterone starts going up, the cervix is closed, so we don't want to have some contraction from the uterus while the cervix is closing. The other drug we can use, but I will say be very careful when you are using this drug, is prostaglandin, synthetic prostaglandin. Why do we need to be careful? Because prostaglandin can affect the development and the functionality of a CL. So to make the advantage of prostaglandin is you give one injection and it works for 24 hours. But the disadvantage, as I'm telling you, is that it can affect the functionality of the CL. So if you use prostaglandin, I will recommend to use it prior to ovulation. So only when you are using natural breeding or breeding with fresh or cool semen. Never use prostaglandin with frozen semen, because remember, when you are using frozen semen, we try to breed the mare as close as possible as ovulation, and most of the time even within 4 to 6 hours after ovulation. So in that case, don't ever use prostaglandin. And it has been shown also that prostaglandin can cause some anovulatory hemorrhagic follicles. So make sure that when you decide to use prostaglandin, you're aware of that and do it as early as possible. But personally, I'm using oxytocin. It works very well. There is no contraindication of using oxytocin whenever, prior or post-ovulation. So this is my treatment of choice. So combined to the ecbolic, I'm using uterine lavage. I'm doing uterine lavage. So to make sure that I will remove all the debris that are present in the uterus. So when I'm doing uterine lavage, in two cases, when I have more than 2 centimeters of fluid in the uterus, or when I have hyperechogenic or echogenic fluid. And with the echogenic, hyperechogenic fluid, I use this treatment even if I have less than 2 centimeters, because the liquid that is present in the uterus should be completely black at echography. If you see some speckles, some stuff floating in, you need to lavage the mare for sure. So it will help, as I was telling you, to clear the uterus of the debris. We can use lactate, ringer, or we can use also isotonic saline solution. When are we lavaging the mare? Most of the time, we are lavaging the mare post-insemination. We can start lavaging the mare 4 hours after insemination, because 4 hours after, we are sure that all the viable spermatozoa are in the oviduct, and at that time, there is no risk to flushing out the semen. But some researcher in Texas showed that you can lavage a mare an hour post-insemination when you are using the deep horn insemination technique, which is mostly used when you are using frozen semen also. Sometimes you can have a mare that you have to breed, and you do your examination, ultrasound examination, and she has fluid before being bred. So do we have to lavage her? Yes, I do lavage a mare prior to breeding. The only thing is I'm not using saline solution, I'm using only ringer lactate solution. Why? Because saline solution is toxic with sperm, because you're gonna lavage, you're gonna remove all the fluid, but you might have a little bit of fluid stuck in the uterus by the time you're gonna breed. And if you are using saline solution can be toxic to sperm. While when you are using ringer lactate is not toxic to sperm, so you can go ahead and use a ringer lactate at that time. So on this picture, the picture on the right, it was my mentor, Michel Leblanc, doing a lavage. So we use a bivona. I use mainly a bivona catheter, so a tube with a balloon that I inflate. And I prefer, when I inflate this balloon, I prefer to inflate this balloon with liquid, so saline or ringer, depending on what you're doing, just because of with the liquid in the balloon, you're going to have the tip of the tip of the catheter that will go down, and to get the liquid back, it will be easier. So, and here you have on the left, you have some bags, the efflux, which is cloudy. It is not good. So when I have some cloudy efflux, I used to add bags, I used to lavage until the efflux is clear. So you see here, the one on the left is not good at all. The one on the right is better, but there are still some debris in, so I keep on lavaging. So that's why I don't have a special recommendation if I put 1 liter, 2 liter, 4 liters total. It depends, but I go from 700 milliliter to 1 liter, depending on the size of the mare, and I do it. I fill the uterus, I go in the rectum, I massage the uterus to make sure that I have all the debris mixed with the liquid, and then I get the liquid back. And I do it on and on until the efflux is clear. And I used to lavage several days also. In very, very bad case, I can lavage twice a day, but mostly I lavage once a day, and I do it for several days. So do we have to use antibiotic systematically in post-breeding endometritis mare? I will say no. The fact of you using antibiotic all the time, you're gonna cause some resistance, and you're gonna cause yeast endometritis. And yeast endometritis is the worst thing to treat. I will say it's almost impossible to get rid of it unless you use some techniques that I will develop later. So I use, and when I have a mare with a persistent breeding endometritis, I do a sample, I take a sample, I do a culture and a sensitivity. If the culture is positive, I will treat the mare depending on the antibiotics that will work the best. So depending on this antibiotic, you can use it directly in the uterus, but some antibiotics you cannot put them in the uterus directly. You're going to just start a fire there, and it will not be good for the mare. So some antibiotics, you're going to use them intramuscularly, intravenous, depending on the antibiotic. But I make all the time a culture, and then if I have something, I go with sensitivity. And when I treat in the uterus, I treat exclusively in a mare in oestrus. I never go in diastrus, in the uterus of a mare, to put whatever is, because you can cause also yeast endometritis. It's very, very important. Treat only in a mare in oestrus. So I'm gonna treat the mare during her oestrus, then she will go on diastrus. What I can do is 5 days after ovulation, I will short cycle her. I will give her prostaglandin to bring her back in heat. At that time, I will culture again and see if the pathogen is still here or not. If the pathogen is gone, good for you. I keep on working to breed that mare. If the pathogen is still present, I do another sensitivity and I treat again. This is the way I used to do it when we are talking about antibiotic. And so, yes, I was telling you, so the problem of fungal yeast endometritis, very important. So don't go in the uterus of a mare in diastrus unless it is something very specific you want to do. Personally, when I do a breeding soundness examination, I like to do my biopsy in a mare in diastrus, because the state of diastrus is a state of pregnancy. So I have a clearer picture of the endometrium at that time. But after doing my biopsy, I give the mare prostaglandin to bring her back to oestrus. I never leave a mare in diastrus after I've been through cervix. So here are some example of antibiotic you can use. So at the end, there is a QR code with all the reference that you can download, and you can have access to all that. So this is from Skogin at Texas. So here are some antibiotics you can use, and also some comments depending on the antibiotic, for example, amikacin, like gentamicin, you never use them like that. You need to use them with the bicarbonate of sodium because it's gonna burn the uterus if you use it like that. So these are the recommendation, and you're gonna have them if you go with the reference at the end. You're gonna find this table and the dose and when to use, what to use, and when to use it. So these are the current treatment. I give oxytocin, I lavage, and eventually I give antibiotic. So it was working a while ago, but now more and more, this treatment is not enough anymore because so there are many things, bacteria are more organized. There are many things that we know better on endometritis now, and it makes that the classic treatment are not the ones that will work the best actually. So is there any people here used to or equine reproduction? Are you doing a lot of equine reproduction besides Daniela? Daniela does not count. Okay, so I was asking just because I will explain more specific things now. So because the traditional treatment do not work all the time, there are some alternative therapies actually that we can use to have better results. So all started with this biofilm story. So what is a biofilm? So this is, I don't know if you know that theory, if it was plain. Oh, sorry, Daniela told me I need to stay here. I used to walk a lot when I'm doing my talk, but I don't have a portable microphone. So there was this theory under the dome. It was in a village. People were trapped under the dome that was completely isolated from everything outside, and they had a lot of issues, but everything was under the dome. So the biofilm is exactly the same thing, because I was telling you, we use lavage, we use antibiotic, but now pathogens are more organized to make sure that the antibiotics that you're gonna put in the uterus will not affect them. They do the same, and here you have bacteria. They are building a biofilm. They do exactly the same as the dome. It means that the bacteria will be under that protection. And then you're gonna treat, you're gonna put antibiotic, you're gonna put whatever you want in the uterus. It will never affect the bacteria because they're gonna stay under. So when the biofilm has been discovered, there were several treatments that was done to make sure that we can break this biofilm, so it will expose the bacteria again, and the treatment will work. So the first treatment that has been made was N-acetylcysteine. So if there are some small animal people in the room, this is a drug we use a lot in dogs when they have bronchitis. So it helps to expel all the mucus collection that you can have in the lungs and in the trachea. So N-acetylcysteine, what it's gonna do? So it's gonna dissolve this biofilm, and it's gonna expose the bacteria. So when you treat the mare, you will be able to destroy those bacteria. So how do we use it? So this is exactly the same product that we use in small animal. We just have to dissolve a vial of N-acetylcysteine, a vial of 30 mils with 100 mils of saline, isotonic saline solution, and we're gonna infuse the uterus with that. And we're gonna leave the product in the uterus for 24 hours. And then 24 hours after, we're gonna lavage the mare to remove all the debris. And if the efflux of the lavage is not clear, we're gonna put acetylcysteine again, and we're gonna wait 24 hours again and do it again. But all the time, we do this work when the mare is in estrus. So it has been shown that And acetylcysteine works very well when you have E. coli and Pseudomonas aeruginosa. There are four very bad bacteria in the uterus of the male that can cause problem. There is strep equi, there is E. coli, there is Pseudomonas aeruginosa, and there is Klebsiella pneumoniae. And Klebsiella pneumoniae and Pseudomonas aeruginosa are the worst ever. They have a lot of resistance. When you have them in the uterus, you have to treat the mare very, very aggressively because they are very difficult to get rid of. But yeast also are very difficult. But here we are talking about bacteria. So, and acetylcysteine works very well for E. coli and Pseudomonas aeruginosa. So you can use it before the treatment. So before doing lavage, before putting antibiotic, before doing anything, we're going to expose the bacteria first. So we treat with an acetylcysteine, and then you go with your treatment with your antibiotic and everything. So what we need to know is if it works very well when you have beta-lactam as in the sensitivity part, it doesn't work very well with aminoglycosid, fluoroquinone, and erythromycin. So you need to know that if you have at your sensitivity these three antibiotics, do not use an acetylcysteine because it will reduce their activity. So there are other you can use. There is an acetylcysteine. There are also some chelatin agent like tricide. So tricide, the common form of tricide, it is a product that it is used in aquarium to clean the wall of the aquarium. So it cleans very, very well. And tricide will do exactly the same for biofilm in the uterus of the mare. So it works for E. coli, again, for aeruginosa, and so for Pseudomonas pneumoniae. And so you shouldn't combine tricide with ceftofuran, capen, or timetin because it will precipitate those antibiotics and they will lose activity. So you need to think about that also when you have your culture and your sensitivity. Do we have to use tricide or an acetylcysteine? It will depend on the antibiotic you're going to use. So now there is another antimicrobial that has been used recently in women with endometritis also, because endometritis can develop in women, and it is seragine. And seragine seems to work very well. It acts differently because it will need to be in touch with the bacteria to be active, and it will break the wall of the bacteria, so it's going to kill them like that, and it will reduce the risk of resistance and everything. So it works very well for strep zoo, E. coli, and Klebsiella pneumoniae. So as you say, again, depending on the sensitivity, the isolation of the bacteria, you can use either of these three products. So this is the first type of product you can use actually to get rid of biofilms. What you can do more is reduce inflammation. Remember, I was telling you that semen will cause inflammation, that will have, you're going to have some debris, you're going to have bacteria and whatever, and it's going to end up with fibrosis. So to reduce that, we're going to use immunomodulators. So there are two types of immunomodulator I'm using. The NSAID, so in NSAID is non-steroidal anti-inflammatory, and I will use also the steroidal anti-inflammatory. So in the non-steroidal anti-inflammatory, Banamine is a bad one. Avoid using Banamine because first, it does not work, and second, Banamine will cause high rate of anovulatory hemorrhagic follicle. And these anovulatory hemorrhagic follicle, when they appear, it is sometimes very difficult to get rid of. So no banamine, no flunixin when you are dealing with endometritis. While you can use furocoxib, it works very well to reduce the inflammation. But why did I put here a star? It is just because we need to double to the recommended dose, because the recommended dose is 0.1. And here, to be effective, we go to 0.2 milligram per kg per os. Is it good? I'm not talking too fast. You good? So this is, if you want to use a non-steroidal anti-inflammatory, I will say use furocoxib, but no banamine at all. So I like a lot the steroid in the case of endometritis. There are two steroids you can use. You can use dexamethasone. Dexamethasone, you're going to use it at the time of ovulation or at the time of insemination, depending what you're doing. When I'm using frozen semen, I give dexamethasone at the time of ovulation. When I'm using cool or natural breeding, I use dexamethasone at the time of insemination. While my favorite is prednisolone. So prednisolone, I give it per os when I start the mare for ovulation. So when I give her HCG or deslorelin to induce ovulation, at that time, I start the treatment with prednisolone. So it's a 4 days treatment. We give the drugs twice a day, and it works very well. To me, it is prednisolone works much, much better than dexamethasone, because there is something that has been shown with dexamethasone is it can affect the functionality of the CL also. So that's why I'm not a big fan of dexamethasone. I know I have colleagues that love dexamethasone, but me, I'm more a prednisolone, and I'm very happy with. So the B-Activate, I will not talk about the B-Activate today. It's something that has been tried in Kentucky to help to identify the bacteria and treat, but I will not develop B-Activate today. So here it's just a paper that you're gonna have at the end also with all the reference that was studying the effect of dexamethasone, flunixin on ovulation and other in the mare. So there are also some extract of bacteria that can be used. This is what literature says about their effect. Personally, I never use those extract of bacteria. I know when I arrived in Montreal, so it was 10 years ago, a lab that was producing those drugs offered me to do a trial, a clinical trial. I was okay with, but I don't know exactly why they changed their mind and they said, no worry, we don't need it, and they skip. So I have no idea if it works or not, but I just putting it here because it has been described in the literature. You can use also other technique like, as you see here, acupuncture. Acupuncture is supposed to work well. So there are two techniques you can use. You can use the traditional one only with the needle, or you can use also the electrostimulation. So you put the needle and you connect to a source of power, and it seems to work, but there are not many studies on acupuncture for me to tell you this is a good technique or not. What we know is acupuncture going to increase the contraction of the myometrium and the uterine tone, so it's going to help to expel the uterus cavity of bacteria, debris, and other things. So these are the traditional treatments. The non-traditional treatment, I will not go through, I will just cite them. Why? Because the American College of Theriogenology does not recommend this treatment. So I know many vets in Kentucky who are using it. It can work sometimes, but what you have to know is if there is a problem, if the client sue you because these treatments are not validated by the American College of Theriogenology, you will be in trouble if the client takes you to court. So what they do, instead of doing lavage, instead of using the soft treatment, They are just using very, very aggressive treatment like hydrogen peroxide, like hypertonic saline solution, and even kerosene in the uterus. So I know that in Kentucky we're using kerosene, and they prove me that it works on mares that was old mares with all kind of issues that were not pregnant, that there were nothing you can do with. When you put kerosene in, after that, within 1 or 2 cycles, the mare were pregnant. The mare, whole pregnancy to term, everything was good. But you need to know that kerosene burns a lot. So you need to make sure that around the mare, you protect the mare because it's going to burn. And of course, don't smoke or don't do anything around because the mare going to explode, because you put kerosene in the uterus and you leave it there for 24 hours before lavaging it. So these are things that are done, but as I'm telling you, there are some risks. And if a client sue you and you use some of these treatment, you might be in trouble. So you have the reference also at the end if you want to read more about the techniques they use. But I know people who are using it and I know it works. So now, what are the real advances that we have in equine endometritis? The first one is the use of plasma. So what we do is you have a mare with endometritis, or you think she's going to develop endometritis. The mare has been bred. What you do, you take blood from that mare, you centrifuge the blood, you use, currently we use between 60 to 100 mils of plasma, and you infuse the plasma of that mare in her uterus. Because the plasma is supposed to have some anti-inflammatory, antibacterial properties that will prevent endometritis to develop in the uterus. So this is, I will say, a cool technique that you can use to prevent endometritis in the mare. When I was in Kentucky, we're getting a lot of blood from horses, getting the plasma. You can freeze the plasma. You can keep it frozen for around a year. And so just before using it, don't put it in hot water or in a microwave because it's going to destroy the proteins. You just have to leave it outside until it thawed, and then you use it. You just infuse it in the uterus in post-insemination. Some people do it also before insemination when they don't want to take any risk and make sure that the inflammation will be under control. So the plasma will be a very good option. So now the technique, the fancy new technique, is to use a platelet-rich plasma. So what it is, so we take blood again from the mare, we centrifuge 100 G for 10 minutes, and you have here the blood, the red blood cells are here. You have here two different stages. The one that is rich, so deeper, more thick, and the one that is poor, it is platelet poor plasma, the PPP, on the top. So a study, several studies were done on do we have to use the entire PPP and PRP? Do we use only PRP? Do we use only PPP? So several studies has been made and shown that the PRP, so the rich part, is the most important to reduce endometritis, inflammation due to endometritis. So there is a study made from one of my colleagues, Brazilian colleague, that was published and presented at the American AAEP, is the American Association of Equine Practitioners in 2021. And also it is in the reference, it is described how it does it and what the best technique to use. So you can go there and read it and so make your mind. So what I can say is a PRP is safe also. So we have a lot of growth factor. It has also, so it will help to heal the uterus. it will help also because it has some antimicrobial property, and it will reduce the inflammation that we can have in the uterus post-insemination. So it is the must when you are dealing with mares with post-breeding endometritis. It is actually the must. I will still give oxytocin, I will still lavage, and I will infuse with PRP. But if you use oxytocin, remember, don't use oxytocin too close of the time when you're going to infuse with PRP, because if it is too close, so because oxytocin going to cause contraction of the myometrium, it will just expel all your plasma, it will not work. So before using PRP, I use oxytocin, I lavage, and when I'm ready to use PRP, I stop oxytocin. So there are many publications about the use of PRP in equine, and you're going to have them also at the end, at the QR code you're going to see at the end of my presentation. So another technique that has been studied mostly in Europe, a little bit in South America, but mostly in Europe, is the use of ozone. So ozone is a gas. So the story is to prevent, you're going to put a tube through the cervix of the mare, and you're going to put a certain volume of gas in the uterus to prevent inflammation and so. So it seems that it has some effect it helps to regenerate the damaged tissue, and also it has an effect on the inflammation, the infections that can develop eventually in the uterus. So you have the reference. I never use ozone personally. I have an intern actually in Montreal. He did this vet school in Romania, and he did a study for his thesis on the use of ozone in endometritis in mare, and he told me that it works very well. But personally, I never use it, but it has been described in the literature. So maybe if you want, you can try and see. Just don't feel too much the uterus. The last new technique that we can use is a stem cell. I will say it is mostly for research, because to prepare the cells, it can be very complicated, and it is also a very, very expensive technique. And we don't like expensive things when you are dealing with reproduction, because you're doing your best to have the mare pregnant and to keep pregnancy. So if you spend a lot of the money of your client for techniques like that, and at the end, the mare is not pregnant, it does not look good. So yes, it has been described, but as I said, it is mostly for research, actually. So what we do is some cells are obtained mostly from the bone marrow, and they are prepared in very difficult techniques. So you can use, there are some papers about that. You can read them if you are interested. And it is infused in the uterus, mostly using a deep hone technique or an endoscopic technique, because you have to go all the way through the tip of the uterine horn to deposit your stem cells. And it's supposed to work, but as I'm telling you, it is very expensive, and it's not easy to prepare, and the results are not all the time good. And so when I'm dealing with reproduction, I try to use product that I can have easily, that does not cost a lot of money, and they are known to be efficient. So that's why, yes, stem cells therapy is an option, but it will not be my first option, my very, 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 very last option. And maybe even if the client is okay, I might stop by and go with kerosene instead of going with stem cell therapy, but it is my call. So we've seen here that I am on time, is good? We saw here different techniques that you can use, from the easiest to the more complicated technique. But are those techniques enough? I will say no. It's not just because you put some ozone in the uterus or you put PRP in the uterus that things will work. There are other things you need to do to make sure that you're going to have the maximum of chance to have the mare pregnant. The first thing is you need to stay clean. So stay clean is when you are working, preparing the mare. I use tout lavage with soap. I use regular soap. I don't use soap with antiseptic like, what is product? It was in your, again? Chlorhexidine and other. I never use product with chlorhexidine because chlorhexidine gonna kill the sperm and gonna cause a huge inflammation also in the vagina. I use just regular soap. I dry the vulva region very, very well because water is also toxic for sperm. If I collect a stallion, I wash the penis, but only with water. Never use soap, any kind of soap on the penis of the stallion because it's gonna change the microbiota at the level of the shelf and at the level of the penis. And it has been shown that when you use soap, you have all kinds of bad bacteria that will develop. And you're gonna find them in semen, or if it is natural breeding, also you're gonna find those bacteria in the vagina of the mare. It is not something we want. So clean the penis only with water and dry it also very well. So first thing, you need to stay clean. Second thing, I will say you need to minimize, before going to the defect, we need to minimize the number of insemination. A mare that is prone to develop endometritis, I try to induce ovulation, and I try to breed that mare only once. Because the more you're gonna breed that mare, the more semen will be present in the uterus and the more the inflammation will be. So breed that mare only once. Third thing, correct the defect. So mare with a bad conformation, they need a calyx. So depending on how bad it is, I can do a temporary calyx prior and immediately post-breeding. And when the mare has been confirmed pregnant, at that time, I do the real calyx. So what I do, I will cut a little piece of skin part of the vulva, and I will suture it, and I will keep it closed. So it will prevent the mare to aspirate air, and also it will prevent some feces, dust, and other things that can be seen in the vagina that will cause infection and cause endometritis. So here you have the process. So we're gonna cut two little, on the two sides of the vulva, we're gonna cut little pieces of skin, and then we're gonna suture it. And at the end, it is like that. The mare is pregnant, it is suture. You don't suture to the end, of course, because the mare need to pee. And very important, don't forget to remove this suture at the beginning of the last month of pregnancy, because the last month, the mare, sometimes we cannot predict exactly when she's gonna fall. And if she falls with a calyx, there are several things. You can have some damage in the vulva, come here. So these are some examples I had on mare with calyx that fall. And the other problem also, you can have problem with the fall because the fall will be stuck during a certain time in the vaginal canal. You can have broken ribs that can kill the fall if the fracture most of the time occurs on the left side, because the ribs are just going to perform the heart and the fall will die. And also you can have some vaginate necrosis also in the mare, and she can be very sick of that. So if you put a calyx, make sure at the last month of pregnancy, you remove the calf leaks so the mare can fall without any problem. The mare also need to exercise after breeding. So here these pictures where I was at the faculty in North Carolina State University. So after breeding the mare, they were outside all the time. You see, they have plenty of space. They were walking, running. Exercise is very important. It helps to empty the uterus. And as I was telling you also, if one of these parts you can have a stallion around, it's gonna help also. So give a lot of space to the mare. Don't keep the mare in a stall. Let her out. It is the best thing to do. And so that's all I wanted to say. And I wanted to thank you. And thank you, my mentor, Michel Leblanc, who taught me a lot on endometritis. And if you use this QR code, you can have an access to all the bibliography I spoke to you about, and you can download it and have all the reference if you want to learn more about that. So you can use this document. If you're not able to download it, I will send it to Dr. Hilda and she can send it to you if you need it. So if you have any question, I will be more than happy to answer. Yes? So why I didn't have that microphone then? They are going to check if they have. But she has one. Now they have. Okay. It works to download the file.
When you mentioned that when we put antibacterials, that we can cause resistance.
Yeah.
And the other thing you mentioned, what was it? I got lost. You mentioned two things. You mentioned that we can cause resistance.
And also you can have a development of yeast endometritis. Fungal or yeast, it is the same.
Okay.
Yeah. Because most of the time when you have yeast is when you are using antibacterial without any control. Because I know some people in Kentucky, you breed the mare, the next day they come, they put TMS or penicillin or whatever in the uterus, and that's it. Because people think that if you don't put one shot of antibiotic in the uterus, the mare will never be pregnant. It is a very, very bad practice because you cause some resistance, because there is even no proof that there are bacteria there. And just one dose of antibiotic in the uterus, to me, does not mean anything. As I said, when you use antibiotic, you need to use every day during all the estrus period. Then you short cycle the mare and you check if bacteria are still there, you treat again. But you just don't come and say, some of them like TMS, some of them like penicillin, some of them put oxy in. It doesn't make any sense. So first you have resistance, but also it creates an environment where fungus can develop. And if fungus are in the uterus, it is very difficult. Usually I treat with vinegar. I use other antibiotics that are very expensive. And if it doesn't work, there is still the kerosene option for that. But usually we don't want to go to kerosene option.
Okay, yeah. Thank you.
Welcome.
¿Alguna otra pregunta? Francisco.
Thanks, Dr. Yao. It was a very nice talk. I have two questions. My first question will be, is every mare will develop post-breeding endometritis?
Okay, I will respond to the first if you want. So I say no. Mostly we see those post-breeding endometritis on medium age or old mare because there is a change in their conformation. A normal regular mare after being bred, within 48 hours, if the conformation is good, if there is no defect on the cervix, she's supposed to expel all the debris and she cure herself. At the beginning, you know, when I was talking about physiopathology, we called those mare resistant mare. When, oops, oh shit, sorry.
Don't worry.
I lost something. When the mare, you know, is not able to clear her uterus by herself, mostly, as I said, because she's old or she had bunch of folds. At that time, if you look at the conformation of the mare, even the rectum, instead of being straight, it is like it's going like that down. So because the rectum is going down, so as the abdominal cavity also on a mare that had several folds, she has a big belly, so the uterus has a tendency to be a little bit down. And what's happened at that time is when you have uterine contraction, the contraction are never enough strong to balance and have the fluid out. So at that time, the fluid will stay in the uterus and it causes inflammation. And at that time, even oxytocin is not enough. At that time, what we do lavage. I do a lot of lavage on these mare. So not all the mare need this treatment, only some of them, and mostly medium old mares. But I saw also sometimes young mares, you know, with bad conformation need treatment. And as I said, mostly when you are using frozen semen, because frozen semen is very concentrated and cause a very important inflammation. And because of that, you go with post-breeding endometritis. Okay. So your second question?
Yeah, my second question is, in these treated mares, we will have a problem with fertilization when we're using these treatments, because we are using frozen semen.
Yeah.
Then we are using antibiotics or other stuff. That will cause something to the first fertilization process.
Okay, so usually when I use antibiotic, usually I don't breed that mare because that mare is called dirty. And of course, if you have bacteria there, I don't breed them. I treat the mare, I short cycle, I check again. If she's clean, I breed. If she's not clean, I treat again, and so and so. And in Kentucky, it's in Florida also where people are doing that, but in Kentucky mostly when a mare is going, because they do a lot of natural breeding because they are thoroughbred, when a mare is beginning her heat, before going to the stallion, the owner of the mare needs to provide a paper showing that the mare has a culture and a cytology and it was negative. If they don't provide that, there is no breeding at all. Because so if you have bacteria, of course, it will not work. And the thing is, if a stallion breeds a mare that is infected, there are two problems there. First, it can be an STD. It can get some bacteria from that mare, and then it will be a big problem because it will not be able to breed anybody else. And second, if you have bacteria, you are, I will say 99.9% of chance that the mare will not be pregnant. So it will decrease the success rate of that stallion. And knowing that the price of the breeding is related to his success, not only because it's a good stallion, but his success rate in having mare pregnant, you know, the owner will lose money there. So that's why all the mares before being bred need to have a negative culture and negative cytology. So if I have a mare prior to breeding with fluid, I was telling you I lavage and everything, I took some shortcut because on those mare, I will also do a culture and cytology. If I have any sign of infection, I will treat, I will not go to breeding. If culture and cytology are negative, at that time, yes, I will lavage, I will give steroids, and I will breed the mare, and I will lavage after breeding. But those treatments, lavaging, steroids, does not affect pregnancy rate. But it has been shown that with dexamethasone, it can affect the effect of the CL, and knowing that the CL is very important because the progesterone is a hormone of pregnancy. If progesterone is not enough, the pregnancy will not go through. At that time, if I use dexamethasone, I have a tendency to give Resumate, so synthetic progesterone, to make sure that I have enough progesterone in the system.
Okay. And if the infection is already corrected, but we have a persistent endometritis, we will wait to the next
Yes.
estrous cycle.
Yes, yeah.
Thank you, Dr. Dea.
So we have two questions in Zoom. The first one is from Ninel. Have you ever used DMSO in your reproductive practice? Does it work? Can you tell us about your experience with it?
I use DMSO on postpartum mare mostly when I have vaginal necrosis and other mostly. And if you remember on the list of the product, I will say be very cautious. There were DMSO. So I don't use DMSO when I have just an endometritis mare. And I use it only when I have some bad lesion, dystocia, or vaginal necrosis. I use DMSO in that case, but no in endometritis, and it stings too. So I don't like DMSO.
So, okay, thank you. Another question from Jacqueline Arrazola. What is your experience with mares with very pendulous uterus? Have you tried the uteropexy with these mares?
Uteropexy, I know when I was in North Carolina. When I was in North Carolina, there were a study because as I was explaining to our colleague, the uterus has a tendency to go down, and they were trying to find a technique to get the uterus up with suture and keep it horizontal. The problem of uteropexy is, so as far as the mare is not pregnant, it's okay, but you're gonna have a mare pregnant. You're gonna have the weight of the fetus, you're gonna have the weight of the envelope, the weight of the fluid, and the risk in that case is that your uterus, you're just gonna tear it because of the weight, because it's with the gravity, it's gonna have, there will be a lot of tension on the uterus. So as far as I know, in the studies that I made in North Carolina, it is not something that we recommend. If you want to have the mare pregnant, if it is just like that, but if it is just like that, you don't need to have to go to this technique. So to me is something I will not try.
What about the use of Coca-Cola for the biofilm?
As a Coca-Cola, I heard about that. I will say it will go a little bit close to all these products that we put in the uterus to get rid of fluid, of inflammation, and so. I will say I will rather use Coca-Cola than kerosene for sure, and to reduce the inflammation. And also, as you're working with honey, I know there are some study on honey to reduce the endometritis in mares. It has been done in the cow, and now it has been tried in the mare also. It is something, yes, I will say it will not hurt very well. So I've never used Coca-Cola, but if I had to, yes, I will go and yeah, no problem. Yeah. I think it's gonna make, because of the gas, because of the acidity, maybe it's gonna help to get the uterus cleaner, because I seen the effect of when you put a coin, a dirty coin in Coca-Cola overnight. I see how it looks like the next day. So it cleans a lot. So I will say yes, instead of using peroxide, ultra concentrated peroxide, I rather use Coca-Cola. I never use it, but it is logical to use it, and I think it should work. Yeah, and Daniela said it works.
There is another question. It says, I would like to know how you combine the PRP treatment with the lavage. Will you use oxytocin, or you avoid the oxytocin to not interfere with the PRP?
I will avoid oxytocin. What I will do is I will lavage, I will infuse with PRP, and I will lavage the next day. I will infuse again, but I will not play with oxytocin in that case. And I forgot to mention PRP, you can use it very early post-insemination, but you can use it also prior to insemination. It has nothing that will affect the spermatozoa by itself, so it can be used before or after insemination. Yeah. But I will avoid oxytocin just because of oxytocin will use contraction. Maybe what you can do, if you want to use oxytocin, you lavage the mare, you give oxytocin, you wait around 4 hours, and then you put PRP. So it will be far enough, but you will have to go twice in the uterus of the mare. That's it.
So another question from Zoom is, the infusions that I have to use must be diluted to avoid being irritating?
What?
The dilutions that you use for the infusions are diluted?
It depends what product we use. So as I said, when you use N-acetylcysteine, you dilute it. When you use tricide, you use it as it is because the solution is ready to use. The other one, the one that is used in human also, you can use it as it is. It depends on the product. As what is very important is about, I will say, the antibiotics, because some of them are very, very irritated, so irritant. So you really need to make sure of what you're doing. So the one I'm using without not big deal is the TMS or the penicillin. I dilute it, not because I need to dilute it, I need dilute it just to make sure that I will have a good repartition of the antibiotic in the uterus. That's it. But some of them are very irritant, and you need to make sure that what you're doing, it's correct, and that's why there are these paper of Scoggins you can use. And so yes, Seragine was the name of the product I was thinking. But when you use antibiotic, make sure that the pH is okay to be in the uterus without causing any problem.
Okay, so we have another question from Vanessa. Hi, from your perspective, you believe the new technique mentioned will continue developing until they are accepted, or is endometritis well controlled with the currently treatment that you use?
So far, the new technique, the PRP is accepted as it is. The PRP is accepted. Ozone, as I said, it seems to be okay, but I don't have experience in ozone, and there is not many publication on it. So maybe ozone, I don't know, maybe stem cells, according to the Brazilian group, because it was Alvarenga's group that developed that technique, is very, very confident that this technique works. But the problem, as I was saying, is it is very complicated to get these stem cells. The process is very expensive. And mostly, if you want to do the things right, you need to have an endoscope also to to put the product in the uterus, or you can just go with a deep wound insemination. So there are some things that make it might or might not work, but because of the price, stem cells are not very widely used. So I will say they are supposed to, but I cannot guarantee. If I have to choose something, I will go with PRP or plasma. That is very easy to use. It does not cost much. You just have the centrifuge, and it works. So yeah, so
Okay.
far this is the technique. But you see, few years ago we were happy with the other techniques that I developed, but bacteria also adapt, things adapt, and we might have to go to other things. And as there are the organite, I don't know if you heard about that. I know there are a project in France about that, to develop organite for the uterus to work better on endometritis. But yeah, it is so far PRP will be my best, and plasma will be my best recommendation.
Ok. ¿Alguna otra pregunta del público? No? So, no more
People in
questions.
Zoom were more active than you. Come on.
So, thank you very much, Momo. Muchas gracias. So, thank you.
Welcome. So I have a request from my friend from Zacatecas. So they offer me this hat. And now the deal is, wherever new place I go and I give a talk, first I need to keep the hat on. And they want to see a picture of me with the students that were present to show him, yes, I give the talk, and there, yes, I had the hat. So if you don't mind, if you want to come around, we take a picture, and I'm going to tell him, yes, I give the talk, and I have the hat.
Entonces, chicos, si están dispuestos y quisieran tomarse una foto acá al frente, por favor, gracias.
The cap off. People from Zacatecas are very, very demanding.